Up, how do you tailor your approach to gum disease treatment for patients with varying levels of dental anxiety?
Yeah, so there's two questions there is gum management and then anxiety. Well, a lot of times people just when they first come into the dental practice, they already have anxiety.
Hmm.
And so the walls are already up. And so they're afraid to hear what they may hear.
Hmm.
So if they haven't been for a while, they're expecting to hear a lot of bad things. When they know things are going on, they don't want to hear the things to confirm their fears. And so how I manage that is you got to read into the body language, the things they say, and really tailor the way you build rapport and communicate with people to tell them what you see. Because at the end of the day, when you think about gum disease is a wide range of conditions. It can be really, really healthy, where you don't have gum disease, but then you creep up the scale of going from mild to really severe. There's different type of treatments.
Hmm.
And so there's so depending on your diagnosis and what you see, you prescribe the right type of treatment or cleaning for that condition. If you can imagine when a patient first comes in, after 5 years, they're going to have a lot of stuff on their teeth, a lot of tartar buildup. They're going to have gums that are really, really puffy.
Hmm.
There's going to be a lot of bleeding, some tenderness around the gums. And it's been 5 years. They missed at least two cleans a year, which is a total of
10.
10 cleanings.
Hmm.
And so, would it be easier to clean, the teeth that have not been cleaned for 10 years, or the teeth that has been cleaned for every 6 months, 6 months ago?
Teeth have been clean for 6 months.
Well, right, and that's where you can do healthy mouth cleaning. So a lot of times people think, oh, when my teeth cleaned, they think about the healthy mouth cleaning,
Hmm.
but that's for every 6 months that you come in. If you go beyond that, there's a good chance you're gonna have to go up the scale to get something a little bit more extensive.
Hmm.
You haven't been for 5 years, you're gonna have to get something a lot more extensive. You haven't been for 20 years, it's gonna be a lot more extensive. It's not all one the same. We don't clean teeth. We actually treat the gums for inflammation. And depending on the amount of inflammation that is present in the gums, that's what type of clean there is. And so now you have the type of cleaning, you have the apprehension or anxiety of a patient, and you have to communicate that in a way to allow them to achieve their goals and to also kind of ease the fear that it's been done before and we can get to whatever you want to go to.
Hmm. Okay, and do you think that's why people are like scared of the dentist? 'Cause a lot of people are like, "Oh, I'm scared of the dentist." Is because like they know they're gonna hear stuff they don't want to hear, or do they know like they've been slacking so much that like it's gonna be painful?
Yeah, I think it stems from the fact that they hear things or experience bad things from when they were kids.
Hmm.
And so they heard that stuff from their friends, their family, their parents throughout life. Oh, the dentist is horrible. The dentist is terrible. It's painful. It's painful. It's painful. The question they get asked though is, what kind of condition was your mouth to make it be so painful and make it a
Hmm.
really, really bad experience? How many people do you know that you go to school with say, and they say, oh, hey, I went to the dentist. It was the best dental visit ever. Everything was great.
Like none of them.
None of them at all, right? They go to the dentist. What happens? Oh, I have a cavity. I gotta go fill it. Everything's so native with the dentist,
Hmm.
and so that's number one. That's what causes the anxiety, right? Anxiety is something that you are fearful of the future, what has not even happened yet.
Hmm.
Right now, you could be a little bit more worried because of something what happened in the past, a little more in a depressed state. But anxiety is something that has not even haven't happened yet.
Yeah.
So the best thing to do in order to avoid that is to what? Take care of your teeth
Hmm.
and your gums. And when you go to the dentist, it's easy peasy.
And
I
don't
mean,
slack on those cleanings.
don't slack on the cleanings. Don't slack on what? At home.
Just flossing, the brushing.
Yeah. And then what kind of foods do you eat?
Yeah, eat clean.
Eat cleaner foods. And so the foods is simple. You got to eat just good, solid, whole food, plant-based type of foods.
Hmm.
I'm not talking about crazy diets, no veganism or vegetarian, but they eat more plants and vegetables and fruits.
So just eat what's from the earth. Just
Eat
eat.
fruits from the earth and don't eat as much processed foods.
Hmm.
All that hidden stuff in processed foods is killing people's teeth.
Yeah.
It's in their bodies.